Assalamu alaikum. Today we are going to solve MCQs, and before it, this is a SPSC master book for nurses, for staff nurse, head nurse, senior nurse, nursing instructor, and clinical instructor. This book is very helpful for preparing yourself. This is a smart and very brief book for SPSC Commission. And we are also offering online classes via Zoom app from 1st March. So interested candidates are invited to join us from 1st March, and registration will be started from 25 February. There is first first and 17. So this is a linkage of other two lectures. So MCQs number 17. In human being, infection of plasmodium causes. We know the infection plasmodium is caused by protozoan. Actually, plasmodium is protozoan which causes malaria. The answer option A, tetanus. Tetanus is also called jaw lock. Tetanus toxide, it's a bacterial toxin agent. Then option B is malaria. Malaria is correct answer. Then option C, influenza. Influenza is caused by Haemophilus influenza, is a viral infection that cause flu, pneumonia, and other respiratory tract infection. And option D is typhoid. Typhoid is caused by Salmonella typhi. This is also a bacterial infection and gastrointestinal disease. The correct answer is malaria, and there are 5 species of malaria we have discussed in previous lecture. Question number 18. Which of following can cause cancer as well as cure it, depending upon its intensity? Option A, tobacco. Option B, alcohol. Option C, ionized radiation. Option D, ultraviolet rays. So we never use tobacco for the treatment of cancer, alcohol, or ultraviolet rays. Ultraviolet rays also cause cancer, but we never use it for the its treatment. Ionized radiation, the radiation also one of the type of radiotherapy of cancer. Question number 19. DPT vaccine, diphtheria pertussis vaccine. DPT vaccine does not give protection to a child from DPT. The full form of DPT, diphtheria pertussis and tetanus. So the option A, tetanus. Option B, polio. Option C, uh, tetanus, and option D is whooping cough. So the polio is a viral disease. The vaccine, polio vaccine, is the preventive vaccine for the polio. Then the DPT, the diphtheria, pertussis, and tetanus. The whooping cough. Here is option number D is whooping cough. Whooping cough means pertussis. The second name of whooping cough is pertussis. So as we know, the diphtheria is a respiratory tract infection which cause the difficulty in breathing and block the airway. The pathogenic agent for diphtheria is Corynebacterium diphtheria. Corynebacterium diphtheria is the causative agent of the diphtheria, and causative agent of whooping cough or pertussis is the pertussis bacteria. So tetanus, diphtheria, and whooping cough are the bacterial infection. Rather, the polio is the viral infection, and polio vaccine is a separate vaccine for polio. Question number 20. 20 MCQ is a leukemia is a disease of leukemia leukocytes. Leukemia means leukocytes. Leukocyte are white blood cells. Mia means blood and leuko means white blood cancer disease. So the option A is skin. Skin is not a leukemia. Eye is not, and the option C is correct option. Blood cells. Blood cells. Which blood cells? White blood cells, leukocytes, and option D is heart. So here we can its correct option is blood, white blood cells. Leuko means white, mia means blood, white blood cell cancer or white blood cell disease is a leukemia. Here is the skin. Skin, sometimes the some patient have white patches or white color skin pigments deficiency or disease is called leukoderma. Leuko means white patches, white skin, and derma means skin. Leukoderma. The eye infection, trachoma is a repeated question, MCQs in SPSC and in our lectures also. Here is question number 21. Which among the following is a waterborne disease? We know the vector-borne disease, food-borne disease, waterborne disease. So here is the which among the following is waterborne disease. Option A malaria, option B influenza, option C cholera, option D viral fever. So here the correct option is cholera. Cholera is the waterborne disease. The infection or bacteria of cholera transmit through the water in the patient. The malaria is the vector-borne disease. Mosquito, Anopheles, female mosquito is the vector for the malaria. Influenza is communicable disease and also droplet infection from one person to by sneezing to other person. The option C viral fever, there are multiple agents or diseases which cause viral fever. For example, influenza is a viral fever, cause viral fever. Measles fever due to the measles is also viral fever. AIDS fever due to AIDS is also viral fever. Fever due to chikungunya is also viral fever. Fever due to chicken pox is also viral fever. Fever due to the hepatitis, viral hepatitis A, B, C is the viral fever. And fever due to the herpes simplex is also when there is any question in your question paper or during the viva, what are the viral fevers, you can list it. Influenza, measles, AIDS, chikungunya, and chicken pox, hepatitis, herpes, and so on. Here is the next question. The antibiotic penicillin is obtained from. Where from the penicillin is obtained? From, as we know, the antibiotic, anti means against and biotic means bacteria. Any drug which is against the bacteria is called antibiotic. So it's a first option, bacteria is incorrect. Plant is not correct. C, weeds are not correct. But there is fungus. Penicillin is extract or formed from the fungus. The name of fungus is Penicillium notatum. Penicillium notatum is the one of the type of fungus from which penicillin antibiotic is made up. The what are the seaweed? Seaweeds are the marine algae, which is also beneficial and used for the many treatment of many diseases. Here is the option question number 23. Antibodies. What are the antibodies? Any substance which are against the antigen is called antibiotic. Here the correct option is A. Antibiotics are actually protein. The drug antibiotic are made up from the proteins. Different proteins extract from the plants, extract from the seaweeds, extract from the fungus. There are multiple, but the protein of many things is used for the antibiotics. The correct option is protein. Then antigen. What is antigen? We must know the antigen are actually foreign body, the any particle which invade our body and cause any abnormality are called antigen. It may be pollen, it may be bacteria, virus, fungus, protozoan, or any other things, dust, or any foreign body. The all the things which are not the part of our body are called antigen. There is a lipid is fat. This is not a correct option. None of these. So the correct option for the antibodies are protein. Then 24, question number 24. The disease in which bronchial tube become narrow due to the spasms of bronchial muscle